Good evening, everyone. And I would request all of you to turn on your videos. Okay, great. First of all, I would like you to welcome to this panel discussion. Thank you for taking the time out to join us at the 2021 summit. And I would give brief introductions of the panelists, and then Amir, you can take over.
One of the big questions people have today, are around this this push into the pandemic, and as we really listened to Victor talked about the fact that everyone was patting themselves on the back about how really the diffusion of digital health had taken off. We had seen this revolution. We went from single digits for remote patient monitoring and telemedicine to double digits, but not enough attention was really paid to those 13 million and probably more individuals that were on the other side of that digital divide. And certainly that's something that more people are paying attention to now, and more people are gravitating toward and trying to really understand more of. And I think the cornerstone of what we have is this bottom line of we need to do a better job reaching the other side of that digital divide and making sure that we have a really strong effort in terms of how people are actually putting together programs to reach folks that don't have smartphones, that are using, maybe they're still using landlines. And so one guest and one person in the HITLAB community and in the Columbia community who's been an expert on this and really getting across that digital divide has been Michelle Odlum, and we're really happy to welcome Michelle. She's an informatics professor in the School of Nursing. Hey, Michelle, how are you? And we're excited to really ask her a series of questions around the digital divide, not just in the United States, but around the world. Michelle's done a lot of research overseas, and again, I think has been one of the leaders in publishing and researching about social media, et cetera, in that area. Hi, Michelle, how are you?
Hi, Stan. Can you hear me?
We can. Thank you for joining us today. We know how busy you are.
My pleasure.
Hey, so look, the audience, we've got a bunch of folks here from all over the country, all over the world listening in today. And you're one of the world's leading researchers in this area of social media and informatics and how people are, there was a boom in this and now it might be pulling back a little bit. But tell us a little bit about when you do your research, what are some of the sources of information that you use to find out and to really dig into investigational, again, human subject research in the area of informatics? What are some of your sources?
So definitely in informatics, some of the sources that I've used have been some of the traditional measures, whether it's, surveys, but those things tend to take long to not only collect surveys, but to generate the data for them. So when it comes to specific, let's say I'm dealing with patient information, because one part of my research is with aging with HIV and looking at clinical outcomes and comorbidities and the things that lead to successful aging or non-successful aging. So it becomes critical for me to have access to, let us say, claims data, insurance claims data, medical record data, and those types of things, particularly when it comes to electronic health record data. In an ideal world, that's a data set that could be pulled, very quickly, if possible. Now, there are, rules and regulations around, making sure that there's security measures and making sure that, the data's secure, but that's information that's immediate. And also too, and in addition to that, peer-reviewed articles I've used a lot, which, I know sometimes the data is about a year old, but it really does help to understand some of the newer findings, the newer outcomes when it comes to health. And, recently a lot, and I will tell you that I didn't use it as much in the past, even though that I have been a researcher with social media data. I've used it a lot during the COVID. I get a lot of great news through Twitter, which has been a platform that I use for my work, from the CDC, the WHO, the NIH, updated information, daily information.
the interesting things that people always ask is, in terms of informatics, how are you defining that today at the School of Nursing, on the Medical Center campus? How are you defining informatics and that sort of thing?
So what's critical is we have so much data, and informatics is the ability to harness the power of this digital technology that is used to transform data to information knowledge for everyday use. And so when it comes to informatics, we really focus on human computing. We think about the patients, we think about the end users, we think about whether it's the providers. And so with health, it's always how it is that we can utilize this data. And so one of the things that's done, for instance, is enabling like programs, for example, enabling community programs to achieve public health goals by allowing them to have information access to give to their patients. Information that is comprehensible, information that is specific to the patient outcomes, information that patients can utilize to hopefully engage in care with their providers. And so a lot of community-based organizations that work with, and I work a lot with aging populations, really help to support the knowledge of the patients and the understanding of their diseases, and they utilize informatics tools to do that. In addition to that, for example, and a Fitbit is something that people are very familiar with. So it collects a variety of different data points. And so what does it all mean at the end of the day? All of your the heart rate monitor and the blood pressure and your steps, your activity monitoring. And one thing that I have done within my own research, particularly around an intervention that focused on helping people who live with HIV and AIDS with the fatigue management, was to take that data and to show them their activity, their daily steps, their sunlight, their sleep disturbance patterns. And it was bringing the data together and making a visual chart that was developed by one of my colleagues, a nurse data scientist, that showed the patients utilizing moons and stars across a week, their sleep pattern and their sleep efficacy. So at the end of the day, and Stan and I have talked about this before, everyone are not going to be on the same literacy level.